Welcome. My name is Peter Strong. I offer mindfulness therapy via Skype for overcoming anxiety and depression and for working with a variety of emotional psychological problems that respond well to the principles of mindfulness therapy. Now, I offer my sessions via Skype. Skype therapy is a very exciting field. It makes psychotherapy more available and also allows you to receive the help you need from the comfort of home without having to commute to see a therapist. So we use Skype because it allows you to see each other, and that is essential for good psychotherapy and good communication in general. You must be able to see each other. If you can see each other, then there is, in my experience and my clients' experience, no difference whatsoever between therapy via Skype or meeting your therapist in person. As long as you can see each other, there's no difference. It's just as effective. What is much more important than whether you meet online or in person is the approach and also the relationship that you have with your therapist. You must feel comfortable with them as a person and also with their approach. The mindfulness therapy approach is particularly effective for most common psychological issues such as anxiety and depression or addiction or obsessive-compulsive disorder. Of course, I see a lot of clients who suffer from agoraphobia and severe social anxiety. This online service is very effective indeed for working with anxiety. Most of my clients suffer from anxiety in one form or another. The mindfulness therapy approach is particularly good because it teaches you practical strategies, ways of working with your emotions that you can practice and develop yourself between sessions. And that's one of the principal goals of mindfulness therapy, is to give you the tools. So it's not a treatment-based approach. In fact, I do not encourage the use of medications or treatment-based approaches simply because they do not give you the tools to change the underlying cause of your anxiety or depression or addiction. Mindfulness therapy focuses entirely on helping you transform the underlying causes of your emotional suffering. So what are the underlying causes of anxiety and depression and other forms of emotional suffering? Well, the primary problem that we have to address is the way that we become blindly habitual and become reactive and develop patterns of reactivity that just operate without our choice or awareness. These conditioned habitual patterns of reactivity are at the heart of anxiety and depression. Mindfulness is a strategy for developing greater awareness and conscious awareness. That means really seeing clearly these patterns of habitual reactivity. If you don't see them, you can't change them. They remain habitual. But once you see them clearly through mindfulness training, then it becomes possible to break free from these habits. And that's the first primary focus of mindfulness therapy, is teaching you how to see your habits very, very clearly. That's the first step. The second step is about training yourself out of these habitual reactions, seeing them as the first step. But the second step is learning how to develop what we call objective consciousness. That is, the ability to see these habits, the emotions, the thoughts, the memories, without becoming identified with them. When you become identified, you become lost in those habitual patterns of reactive thinking. When you can see them objectively as objects that arise in the mind, then you're able to break free from those habits. So this is a training process. It's where you actually train with your habits. It's not sufficient just to see them. You have to learn how to develop a conscious awareness of them, a relationship with them, where you maintain that objectivity. So objective consciousness, that's the second major focus in mindfulness therapy. It's all about developing a relationship with your mind, with your thoughts and emotions and memories. The third theme that we focus on a great deal in mindfulness therapy is learning how to develop a different quality of relationship with your emotional pain. So typically we become very reactive, we become identified, we try to avoid our anxiety or depression, we seek distraction, sometimes in the form of drugs or activity. We try to do everything we can to run away from our anxiety and depression. This has the effect of reinforcing the emotional suffering. So mindfulness training is about overcoming this habit of avoidance and aversion or resistance or fear of the mind, of the thoughts and the emotions. You have to develop the opposite, which is a relationship based on friendliness and compassion. That is, you have to learn how to be friendly and compassionate towards your own emotions and thoughts, even the unpleasant ones. It is not sufficient to try and get rid of negative thoughts and replace them with positive thoughts. That will simply not work. You have to develop an objective and friendly relationship with your negative thoughts and emotions. This way you break free from their influence, you take away their power, and you develop more power as your true self, the observer, the one that observes these objects of mind. So friendliness, compassion, this is a vital quality that makes mindfulness quite different than conventional awareness. It's not sufficient to just be aware. You have to develop a compassionate, friendly, and open relationship with your mind. This is essential for healing. A fourth aspect of our work is about changing the structure of your emotions. It's about helping them heal. So healing is an essential part of mindfulness therapy, and I will teach you these mindfulness-based methods during our sessions together. So how do you help an emotion heal? Well, one of the principal understandings that I've gained over the years is that the primary structure of your emotions is based in imagery. It's how we see it in the mind. So emotions are structured around internal psychological imagery. When we say that we feel overwhelmed, it's because the image of the emotion is very large and high in our field of awareness. So we have to look at this imagery and objectively, and then find out how we can help that imagery change. Because one of the basic theories here is that in order for an emotion to heal, the imagery has to change. The imagery is what defines the emotion. So this will happen naturally. Imagery changes over time, and if you are not reactive, that imagery will change in a way that will lead to healing. This is how we get over grief or distressing experiences that we encounter in our daily life. The imagery changes over time. It becomes smaller. It becomes more less intense in color or form. So imagery is the key to healing emotions. When we work with the imagery using mindfulness, we explore in a very conscious way how to change that imagery to speed up the process of healing. So that is one of the great advantages of developing a conscious and mindful relationship with your emotions. You can increase the rate of healing. So that's a very important theme that's often overlooked in other schools of psychotherapy. But in mindfulness therapy, imagery is central. So we work a great deal on transforming that imagery. So this is a brief outline of what mindfulness therapy is, and I've described to you the advantages of using Skype. If you would like to get help with your anxiety or depression or addiction or intrusive thoughts or whatever it might be, if you would like help, then please simply email me, tell me more about how I can help you, and when you feel ready, we can schedule a Skype therapy session at a time that works for you. I'm based in Colorado, so I see people throughout the USA and Canada, but I also see lots of clients in Western Europe and the United Kingdom and as far away as Australia. So if you would like to explore mindfulness therapy more and you like the idea of Skype therapy, then please contact me. Thank you.